This position was created and conceived of by Dr. Noseworthy as a way to advance the way Mayo Clinic looks at our employees, looks at our patients, and looks at the world. We are in a changing world that's very diverse, and Mayo Clinic needs to meet the needs of our patients, of our community, and by that getting a diversity of thought, a diversity of backgrounds of individuals, and really aspiring to have our employees and the way we care for patients reflect the needs of our patients. I think the biggest challenge for this position really is the fact that it's a huge position. There are many levels that have been given to me as a charge, everywhere from employees to patients to research participation, in addition to covering all of Mayo Clinic enterprise, both Arizona, Florida, and the health system. So there will be, it is just the scope of the project that's one of the biggest challenges. I think one of the things that we really have going for us to meet those challenges is a group of very passionate individuals, who, many of whom have been working for years on diversity issues, who are going to bring their talents forward. This position allows us to coordinate, to amplify the efforts that have been made in the past. There are many challenges associated with changing a big organization, how we think, how we do things. And I think realistically, there are so many people who are passionate about making this a better place that that part isn't going to be the problem. The challenge is helping everybody understand that becoming a more diverse Mayo Clinic actually achieves that goal. And we have a lot of people on board who already believe that, but I think really having everybody at their core belief that if we change, if we become more diverse, if we all think differently, the solutions to our patients' problems, the solutions to Mayo Clinic's problems and opportunities will all be improved. So I think some of it is, the biggest challenge is helping people change how they think and believe and understand. This position, when it was announced, I was thrilled that the organization, that Dr. Noseworthy was going to take this important issue, and one that's been very close to my heart for years, to this, elevating it to the importance that it really deserves at Mayo Clinic. And at first I hadn't really thought I would seek the position. It was in part due to some encouragement by some colleagues, but also recognizing that I had a lot to bring to this position. I've been involved in issues related to professional development of women, to advocating for health disparities among different groups, and looking at diversity through many different lenses, through cardiology, through my volunteer work, and through work through my professional societies. So in many ways, I realized when I assessed what I might bring, I had some strengths in terms of looking at leadership development and having that broad view. There will be some transitions that will be involved, but one of the things that I think is very important, and that Dr. Noseworthy and Ms. Weiss have assured me, is that there will be resources beyond me. I am one person who will have an important role in setting strategy, but I anticipate that I won't be doing all the legwork. There are a lot of individuals who are already involved in doing a lot of that leg and granular level work in efforts for diversity. And one of the advantages of this position is to pull them all together, amplify their strengths, so we're all working for the same purpose and making sure all the jobs are covered. When everybody values that diversity of thought that comes around the table and respects what people are saying, and we actually use those great ideas that a diverse employee group or patient population brings, Mayo Clinic will keep going for another 100, 200 years. As well, we'll have be very well positioned for the future.